COVID event safety. Follow the science. Hi, I'm Greta Fox, and I'm here to talk with you about event safety with regard to COVID-19. I have a unique perspective. Besides managing my husband's photography company, I'm also a nurse practitioner volunteering with the COVID Action Group and with End Coronavirus under the umbrella of the World Health Network. We're a global coalition of experts in pandemics and related specialties, along with groups of concerned citizens, with a mission to advise policymakers and to empower communities with practical strategies to eliminate COVID-19. For more information or to volunteer, please visit us on the web. As things begin to open back up, we in the meetings and events industry are excited to be back. But the truth is, the COVID is not yet over, no matter how much we want it to be. We have a special responsibility to lead by keeping on the cutting edge of science-based event safety. And with the return of conferences and events and the resulting travel and tourism at a time when the Delta variant is spreading, that becomes more important now than ever. A couple of disclaimers. My science-based position is that CDC has made some serious errors, particularly with ventilation guidance and premature easing of masks and other guidelines, which are essential to event safety, and that the safest thing would be to continue to both wear masks and to limit live events and non-essential travel for now. This was recorded on August 3rd, 2021, and this information and advice will continue to evolve. All guidance found here is my own. I'm going to go over some highlights, and there are additional resources in the downloadable PDF. So let's look at 7 myths and facts about how COVID spreads and how we can leverage science and technology to best protect ourselves, our families, and our clients and colleagues. Myth number 1, COVID is over because vaccines. Well, vaccines are an incredibly powerful tool, but vaccines alone are not enough, and they need us to help them work. COVID is still spreading. Only about half of adults in the US are fully vaccinated at this time, and no children will be vaccinated before school starts, which is nowhere near herd immunity level. CDC's claims that vaccinated people are so safe, even from the Delta variant, that they don't need masks or other precautions, and they can't spread the virus were exaggerated, and they were not following the actual science. And let's be honest, the honor system was never going to be reliable. Meanwhile, the World Health Organization advises vaccinated people to continue to wear masks because of the Delta variant. Vaccines are highly effective, but they are less effective against Delta, which is at least 60% more contagious. It's already become the dominant strain here in the US, and the numbers are heading back up. Emerging data show that vaccine efficacy wanes over time, that vaccinated people can and do transmit and can be affected by long COVID. As COVID spreads, it continues to mutate in ways that eventually will outpace vaccines if this is allowed to continue unchecked. And there is a serious concern in the World Health community about a phenomenon called selection pressure, which can help mutations to develop specifically between fully vaccinated people, which becomes more likely the more the virus spreads. So we need to do everything we can to help the vaccines work. Actions we can take: first of all, get fully vaccinated and encourage others to do the same, but don't rely on it to fully protect you. Keep wearing a mask indoors and keep social distancing, and pay attention to ventilation and filtration. And I'm going to be going into more detail on that with respect to events. Also, while you should confirm that this is still the case in your area, at this time you can legally require your employees and attendees at private events to be vaccinated and to show proof of vaccination. Unless you are the person's healthcare provider, HIPAA does not apply. You want to know your vendors and venues policies on this as well. The more planners who ask about this, the better. Myth number 2, COVID is spread by droplets and you're safe if you keep 6 feet away, and this is simply false. COVID is airborne. It is spread by inhaled aerosols. This central fact has not been explained clearly to the public, and this has to be clearly understood in order to know how to effectively protect ourselves against COVID. So here we go. We breathe out particles of different sizes. The larger ones are droplets, and as their name suggests, they do drop to the ground or onto surfaces within a limited radius. But droplets are too large to inhale. If someone is close to you, any virus in the droplets may invade your body by contact with the mucous membranes of your eyes, nose, and mouth, but this is not the main way the virus spreads. Aerosols are inhaled into your lungs, and that is the main way that the virus infects you. Aerosols linger and swirl around in the air like smoke. And get this, any virus in these particles can remain airborne and viable indoors for hours. Social distancing helps in the short run since the virus is more concentrated around the source being the infected person. But after a while in an underventilated room, there is no getting around the fact that everyone is breathing each other's air. Plexiglass barriers, by the way, do not stop drifting aerosols, and they actually can make things worse by trapping air pockets, especially if they're poorly placed. So what to do? Keep this in mind as your philosophy, and everything else will follow. Don't share your air. Mask indoors for everybody, vaccinated or not. Social distance, but please, no partitions. Transition activities to outdoor spaces whenever possible. Ventilate. Leave any doors and windows open to the outside that you can. And when you're selecting a venue, ask about ventilation and filtration. Ventilation is bringing in outside air, and filtration is cleaning indoor air, and both are necessary. You may get some pushback that the venue is following the guidelines, but the more people who don't buy into the myth that these guidelines are enough and who do push for ventilation and filtration standards, the better it is for all of us. And you will very often find that a friendly person from engineering is more than happy to show off their upgrades. There is more on this on the PDF about what to look for and what questions to ask about ventilation, HEPA, ultraviolet air conditioning, etc. And there's a link to a fantastic comprehensive FAQ website by the world's leading aerosol scientists. So check it out. Myth number 3, COVID is mainly spread by contact with contaminated surfaces. Sterilize everything. Facts, this is not the main way this virus spreads. Look, I'm a nurse, and I am not going to stand here and tell you that cleanliness isn't infection control 101, because of course it is. But it doesn't do much good against COVID without airborne precautions in place as well. So action's quite simple. Keep high-touch surfaces clean, have hand sanitizer stations throughout, but keep your focus on preventing airborne transmission. Myth number 4, masks and face shields are all you need to prevent COVID. Masks are another incredibly powerful, absolutely essential tool, but they're only one tool in the toolbox, and this is because all masks leak aerosols to some degree, and face shields don't block aerosols at all, only droplets. You're much more likely to breathe each other's air indoors, but while COVID spreads much less readily outdoors, it can still transmit outdoors in crowds or in very close proximity to others. So actions are that masks should be worn at all times when indoors with others, as well as in outdoor crowds, vaccinated or not. And please, for the love of God, they have to sit over the mouth and nose. Most of the virus is concentrated in the nose, so wearing the mask below it is actually completely useless. Masks have to be good quality and fit well. There is a resource on this in the PDF. Branded masks can be great swag, but they have to be good quality, and please avoid tempting people to take off their own masks indoors to change into them. Myth number 5, it's safe to take off your mask indoors to eat and drink because COVID magically doesn't transmit while dining. Facts, back to this graphic from earlier, there is no safe distance for mask removal in an underventilated indoor space. COVID does not make an exception to accommodate dining. I know, how rude, right? But that's what it is. The honor system will not hold. Let's just say it. We know people lie. And let's also say that this is a very difficult food service issue to talk about and to deal with. So actions, distancing helps, but it's not enough, and ventilation and filtration are key. If you must serve indoors, serve in shifts to reduce occupancy, avoid buffet service, and do transition dining and refreshments outdoors whenever possible, but with open-sided tents, not with these igloos because they're just like being indoors. And one of the things people don't always think of, indoors or outdoors, turn down the music so people don't have to lean in close or yell to be heard, which generates even more aerosols. Myth number 6, screening will prevent infected people from attending an event. And here are the facts. Symptom screening has a greater than 50% miss rate. And this is because people are contagious before they develop symptoms, and that is when most infections are spread. Temperature screening can be affected by activity, the environment, and by whether they've just taken a fever reducer, and it won't pick up contagious asymptomatic cases. So if you're going to be screening on site, consult health professionals to put a safety plan in place for what to do if someone screens positive that won't expose others. And while it may help, don't rely on screening alone. And finally, myth number 7, COVID testing will prevent infected people from attending an event. And well, that worked out real well at the 2020 Rose Garden Super Spreader event, right? So tests can screen out some people, but the problem is that it takes a few days after exposure for it to show up on a test. Tests can have a false negative rate of up to about 1/3 overall, In fact, if you're tested the day after exposure, the false negative rate is literally 100%. And consider that if people test ahead of time and then get exposed after the test, that won't get picked up. So any plan that involves testing or showing proof of a negative test in lieu of proof of vaccination is full of holes. If you're going to take on the responsibility of performing medical tests, realize there's potential liability involved. You have to have a safety plan in place for where and how to do the tests and what to do if someone tests positive that will not expose others. And while it may help, don't rely on testing alone. But if you do decide to test, bring professionals on site. So to summarize, while we cannot afford to fool ourselves into thinking that there is not still risk involved, best practices for improved COVID-19 safety for live events which choose to go forward at this time include limiting event size, communicating your policies to attendees, venues, and vendors in advance, insisting on high standards for ventilation and filtration, moving activities outdoors wherever feasible, particularly dining and refreshments, requiring proof of vaccination, requiring that good quality masks be worn correctly at all times indoors and in crowded outdoor settings, social distancing, keeping high-touch surfaces clean, and having hand sanitizer available, and keeping in mind at all times that COVID is airborne, that COVID remains an active threat to public health worldwide, and that by understanding the science and using multiple layers of protection, we'll keep safer together. Remember to download the PDF for more information and resources. Thank you.